Hi, my name is Dr. Martin Bales. Welcome, and I'm going to tell you what it is I do here at Cancer Center for Healing and Center for New Medicine. So to start with, I run the PEMF, that stands for Pulsed Electromagnetic Field. I've had the therapy for about 6 years, and it is designed to do a lot of things. It increases ATP production, which is the energy molecule inside of our mitochondria. It helps increase circulation. It breaks up scar tissue, and in doing that, decreases inflammation and therefore helps with alleviating pain. It's all natural. It's about the power of an MRI, and in the realm of the Cancer Center for Healing, it helps patients better assimilate their IVs. How does it do that? They actually did dark field microscope before and after a sample of blood from a patient, before and after 10 minutes of PEMF on a mat, and they found that the blood cells had unclumped, so that once they were clumped, or when they were clumped, they didn't have their normal spherical shape, which didn't allow them to uptake the nutrients associated when they have a nice spherical shape. So it helps uptake nutrients. What nutrients do we do? Well, it's mainly the IVs that we do here at the center, mistletoe, IV vitamin C, salicinium, things like that. It also helps after hyperbaric oxygen. So once the oxygen through pressure is placed into the body, it helps the body assimilate it better, because cancer thrives in a anaerobic environment, a non-oxygen environment. And so if we can create a very oxygenated environment, we can make the cancer miserable. So I always tell patients, cancer's like the bad roommate. How do we get rid of it? We make it miserable. Making it miserable is lots of oxygen. It's higher energy, which the PEMF also promotes locally and systemically. And it's also alkalinity versus acidity. So if we make an alkaline environment, cancer has trouble surviving because it survives in an acidic environment. So that's the PEMF. I have a couple of the attachments. So it's used topically, meaning just over the skin. It will work through the clothes, which is really nice, so there's no disrobing. And for both cancer and for pain, it can be used, for example, like on a knee, if that's not visible, on the shoulder, like this, or over any organ, if there's trauma or cancer there. There's a larger loop to accomplish a larger area, so it can be used like on the chest.
Talk louder.
Okay. Thank you, Kate. Can you hand me that again? Yeah, it's all put together. Okay, so that's for PEMF. So the next we're going to come to actually has a little bit of family history. My father invented the first biophoton in 1998, so 20 years ago. And since then, I have had him working on a new model. This is actually a prototype, but it's a functional prototype that I've been using. And it emits different wavelengths of light through this head unit. And we use it for wound healing and for all soft tissue injuries and healing as well as increasing blood circulation. So through scientific research over the past 20 years, they found that this photon actually releases nitric oxide. Nitric oxide helps vasodilate or open up the blood vessels. So if you can use it over an area and release nitric oxide, you can thereby open up the blood vessels and you're going to increase circulation. So for the realm of pain management and wound healing, you can even monitor it with thermography, which I'll talk about in a second. So wound healing, soft tissue injuries, nervous system disorders, any nervous system disease, and also for pain, because it, just like the PEMF, decreases inflammation and gets the ATP production going as well. So that's for the photon. Okay, and then we'll go, so those are both treatment, the PEMF and the biophoton, and then we'll go into thermography. So my dad, again with the family history, my dad actually invented the digital thermal camera in 1979. And it wasn't for bodies and healing people, it was for missile detection, okay? So it was used to track missiles because missiles emit a large amount of heat, so we could use our missiles to fire down specifically the Russian Scud missiles with our Patriot. So fast forward a few years, 1979, it was incorporated into the medical world in the early 80s, and it was approved in 1982, not just his camera, but a couple other ones for use for early breast cancer detection as an adjunct to mammography. So what does adjunct means? It means with mammography, not as a replacement to it. So officially, it's that, although many women, including those in my family, choose to just do the thermography alone, it's used, the process is about 5 minutes. A woman is placed in a cooled room and different views are taken. There's no pain, no pancake smasher, so no touching. And it's able to detect pre-tumorous conditions. So it looks at heat, it looks at veins that could be associated with a tumor. So instead of a tumor that's usually 8 to 10 years to develop to a size of a pea, we're finding it that many years earlier because it's the veins that are associated with the tumor that's so small that it won't come up on mammography. So that's kind of how it works.
Does it help with naturopathic pain? Neuropathy pain.
Neuropathy pain. Okay, so the question was, does it help with neuropathy pain? And yes, the photon does, and in conjunction with the thermogram, one can take a thermogram and see where the circulation is poor. And it's usually, I call it glove and stocking effect, because if you take a thermogram, it's like where the circulation stops. And then you can use the photon and actually the PMF at the same time over that area to alleviate the pain and actually help regrow the nerves. Because usually with a neuropathy, if it's diabetic, it's usually sugar, and the sugar is actually eating the nerves over a number of years. It's not overnight. So yes, the answer is yes to that question. So I told you a little bit about the breast thermography. Thermography can also be used for pain, like I said, for imaging extremities, but also imaging spines, like to see where a disc is herniated. And MRI can do that too, but the thermogram is really fast and requires no contrast radiation or anything. So it just be very quickly, and then it's also a roadmap of where to treat with the PMF and the photon. And if you want to go even further, you can image a patient and then while treating them, have the camera live going and watch the blood circulation changes. It's kind of neat with the photon and PMF. So that's about thermography. And the last one I'll do is actually my doctorate, which is acupuncture. So a little bit different. That was all kind of Western. The acupuncture obviously is Eastern. It was a modality that was started about 4,000 years ago in China. And it involves inserting very small needles at certain areas, at certain points on the body to help eliminate qi congestion. So qi is life force, it's energy. I liken it to the freeways out here. Okay, if you're stuck on the 405, it's painful, right? Because you're backed up. Well, you're putting that needle in to get rid of the traffic jam. So we use it to get the energy going. I use it in a systemic fashion. You can also use it while you're doing photon and PMF. So sometimes I'll have needles in somebody and do photon and PMF, so they're getting triple therapy. And what I found through thousands and thousands of patient visits here over the past more than 8 years is that the more you can do with somebody, the more sticks you can throw at the problem, the faster they're going to get better. And who doesn't want to get better faster? So acupuncture is also really good for just calming. It stimulates the parasympathetic nervous system, which is the counter to the sympathetic, which is our fight or flight when we get really, really agitated. So it helps with that. Okay, so acupuncture, thermography, photon and PEMF. And I will be bringing a couple other modalities, which I'll talk about at another time, to the clinic in about another month.
So Dr. Bales, how do you interact with the practitioners? How do you complement them with the treatments that you provide?
Okay, so the question was, how do I complement with what I provide, my treatments to the other practitioners? Well, we all work together here at Center for New Medicine, the Cancer Center for Healing. We complement each other in that one of the medical doctors will recommend one or more of my therapies, and I may have some opinion about that as well. But say for pain or for cancer, they'll give a recommendation on when to come, the frequency, and we'll go from there. Do we have any more?
Well, I have a question. When you said that diabetics, the sugar is eating away at the veins,
Yep.
Is that true for non-diabetics too?
Okay, so the question was, when I mentioned diabetic neuropathy, that the sugar is eating away at actually the nerves, but close, and the nerves control the veins, yeah. And the further question was, is that true in other cases of neuropathy? Absolutely. There's neuropathy from alcohol, from mercury, from some of the drugs. And again, this is usage over a long time. This isn't just one time they did something or something that happens. And there's also called idiopathic neuropathy, which is usually a problem in the low back. Because the low back, the patient can have a nerve impingement, which you can see with the thermography, and it'll be impinging it again over 10, 15, 20 years, such that the feet aren't getting the right blood circulation. If you don't have the right circulation, it's not going to nourish the tissues, and bad things are going to happen. So absolutely, it can be from other chemical substances and nerve impingement issues.
I'm taking an estrogen blocker because of the breast cancer I had. So I've got like a lot of nerve pain sometimes and joint pain. Would any of that help with?
Okay, so the question was the patient is taking an estrogen blocker because of her particular cancer, and would any of my modalities help? Absolutely. The photon would probably be the best, but what I've been doing more recently is doing photon with the PMF, because I already have the patient in the room, and it's just easy to do the two at once. That leads me to one other comment. With my therapies, usually patients know within 1 or 2 treatments if it's going to help. So it's not coming to me for 20 times. They know. Now, I'm not saying cured. I'm saying they feel better, and then we do some more treatments, but it's pretty fast, again, because I'm combining these different modalities together.
There's someone who's asking, what do you think of CBD oil for cancer?
Okay, so the question was, what do I think of CBD oil? I'm not a knowledge base on CBD oil. I know it is used quite a bit. Our patients choose to use it here at the center. It also is really good for sleep. I can say personally, it does promote sleep. It's also very alkaline. So in the realm, my opinion is, I think it's alkaline is going to help, but I can't say, oh, it's going to kill cancer. It's going to do this.
So Dr. Bales, talk about the center side, we call it, where it's internal medicine and what you can do for patients for pain. I know that you've had from, young adults to big adults that are athletes that come in, and they have different things. Go walk through that.
Okay, so the question was on the more of the center side. What have I done with the patients through the years? Patients big and small, basically. Well, to start with the small, the kids actually love the PMF. They call it the tummy tickler because it produces a little pulse out. As we know, children are not usually very, very hot for needles, so we haven't done a lot of acupuncture because, hey, as kids, we got the big needles, right? And when somebody says needle in this country, they're thinking the big injection needles or the lesser extent the IV needles. So I've helped a lot of children. They think it's fun. They like the photon. Just feels kind of warm. The PMF is like a tapping. The main thing with patients in pain that come from the center is getting them off the harsh drugs. That's number one, because the drugs will just destroy anything from the intestines to the kidneys to the liver, you name it, and cause a whole bunch of other side effects. And unfortunately, usually because they're on the pain drugs, then they're on other drugs to counter those side effects, and the list goes on and on and on. And who's ever not aware of the opioid crisis in this country right now that's getting worse by the day, it's quite bad. And so it's better to try to avoid that stuff. So patients are already on, I understand, they had a car accident, they were in extreme pain, but to get them off of it is probably my biggest challenge. Well, if I can give therapies with photon, PMF, acupuncture monitored by thermography in more of the complex cases, and can get them so they can start decreasing their pain medication, that would be one of my greatest success, and that's usually what I'm able to do. We have had a couple post-NFL football players. My therapies scale very well, so I have the intensity and the power with the PMF and the photon, that if it's a big guy or a big person, I can scale up the power, or I can scale it way down for a child.
What do you do with situations like bone on bone, or where it's someone that has a ligament issue? Can you go into that?
Sure. The question was, what do I do for someone that has an issue like that's bone on bone or a ligament issue? Well, my therapies play well with others, and so the patient can also do, say, PRP, the platelet-rich plasma, which I don't administer, another practitioner will talk about that, or stem cell or prolotherapy, and do the photon and PMF right afterwards to make those therapies work better. So if someone's really bone on bone, that's what I would recommend. If they have a ligament issue, the photon or combination of photon and PMF, because it's more of a soft tissue, will usually solve that. I did have one gentleman that was older, he's a senior citizen, and we got him on an alkaline diet, and he was near bone on bone with his hip, and this was about 30 treatments, but we actually started regrowing cartilage in the hip, and that was evidenced by MRI. But that was it was like 30 treatments, and it was a very strict regimen of alkaline. Why alkaline? Because not only does cancer thrive in an acidic environment, but the acidic environment eats the tissues, again, over time. So, is there another
Question? Um, let's think of, go into some patient cases that you've done, like the one you just mentioned.
Okay.
Is there something so people understand? Let's say they have a tear. Let's say they've been overzealous, you know, in a situation, whether it's at home and bending over and doing something or picking something up. What have you done for them pain-wise?
Okay, so most of the pain I divide into two categories, acute and chronic. And the acute is obviously a lot easier. Those tend to be more the sports injuries. Not that there aren't some cruise sports injuries or car accidents out there, but usually if I can catch patients before, say, the 6-month mark, that's kind of where it divides between acute and chronic. I can get it. A couple of cases that come to mind are strains and sprains, so wrists, ankles, and it's not just my therapies. Those are great. Personally, I recently fractured my foot, and when I came into work on Monday, everybody had a different opinion, so I just did everything. Of course, I did my photon and PMF. We're not supposed to, as acupuncturists, we're not supposed to needle ourselves, so I didn't do that, but I did an Epsom salt bath. I used compounded progesterone cream for pain, which worked great at night on it, and then I took a couple of the standard process supplements, trace minerals, calcifood, and the silica to help with regrowing. So you see, it's a multi-pronged approach. That's me personally. I mentioned sprains and strains. The most common that I see for pain is probably back pain, specifically low back, and it's usually a herniated disc. Most patients already have an MRI. An X-ray won't show it. If they don't, we can do a quick thermogram to see which disc it is, and then, as I mentioned before, use that as a roadmap to know where exactly to hone in for the photon and the PMF. Usually if patients are compliant, they do a few exercises at home. We're talking 4 treatments. It's really not, maybe for a more chronic case, maybe 6 or 7, but it's not 20 times in to see me for very little result.
That's good to hear. So we have another question. For chemo-based neuropathy, how long is the average, how long do you have to go to see results?
Okay, so the question was for chemo-based neuropathy, how long to go results, even with the chemo cases that are older, so chronic, over the 6-month mark, even up to 5 years. Usually after 2 or 3 treatments with mine, the patients will notice a difference. And that's mine, and possibly a few supplements, probably some, usually it's in the feet, sometimes in the hands, foot detox, Epsom salt bath, nothing too crazy. Yeah, 2 or 3 treatments.
Right. That's good. That's great.
How long does somebody that's coming here for cancer need to go to PEMF?
Okay, so the question was how long there's a patient here receiving treatments for cancer need to go for PMF. Every case is different. Obviously, someone that has stage 1 cancer is different than that has stage 4. And I'd say on average 2 to 3 times a week is usually what we do. You can treat every day. Some patients treat every day. If it's a problem, it's a good problem, is that we have so many therapies here at the center that it's hard to expect someone to do something every day, because on off days they can do other therapies such as hyperthermia, hyperbaric oxygen, your range of IVs. But in long answer to your question, I recommend 2 to 3 times a week.
So how do you relate to what Dr. Jones does? How do you both coordinate therapies? Is there any, do they complement each other, and how so? Okay,
so the question was, how do I relate to what Dr. Jones does, which is called SCENAR, SCNAR, and how do they relate? Well, first of all, we can do them on the same day. My therapies and the SCENAR play well with others, so they're very complementary. The SCENAR is putting out electrical impulses via contact, so it's got a plate on it, and the Russians developed this 30, 40 years ago, and it's been improving ever since, kind of like my dad's photon. And it puts electrical frequencies in as opposed to magnetic. Now, the magnetic, they are related, but they're a little bit different too. The magnetic actually goes all the way through. So when I have someone on my PMF mat, or with one of the attachments that I showed, you'll actually see the other side moving. So if you have them lying face up, you'll actually see the abs fluctuating. So I know it's going through the patient. The SCENAR doesn't go quite as deep just because electrical doesn't permeate. I think it's a great therapy as well. Again, it's another prong in our obviously multi-prong approach here.
Great. Any other questions?
I have a question about the herniated disc causing a pinched nerve. How long of a therapy would this therapy cause the pinched nerve to Continue?
Okay, so the question was in regards to my discussion on the herniated disc and the pinched nerve. The herniated disc is herniated, it's sticking out, and it's usually pressing on that nerve. So if we can unherniate the disc, we can get the pressure off the nerve and the pain will go away. And that's usually what's caused with any kind of what's called referred pain. I'll talk about referred pain. Thank you for reminding me. So in answer to your question, how long would it be? 4 or 5 treatments, but it would involve a little bit of patient, would involve patients doing some exercises and some of that at home to help open up the space. Because what's happened, think of the disc as a jelly donut, okay, and then the vertebra are a T-bone steak. So it's T-bone steak, jelly donut, T-bone steak, jelly donut. What's happened is that jelly donut has gotten compressed over the years or with an accident, and now it's pushing out, and that jelly is pushing on the nerve. If you can strengthen the paraspinal muscles, the muscles that run besides that stack of T-bone steaks and jelly donuts, you'll take the pressure off the disc, and the disc will go back. So good exercises include like yoga and any kind of strengthening. They're not real extreme, and they don't take a long time to do. So 4 or 5 treatments with that.
That's really good.
Oh, referred pain. The other advantage with using thermography, and especially in a feedback system, whereas pre-image is taken and then a live image, like a video is scanned while doing treatment, is you can see if you're getting results right away, because you can see the blood circulation changes, and the patient can see them too. So it's nice to know that you have an objective observer, which is the camera, looking. I can't tell you how many times I've had patients come in and say, I have carpal tunnel. I've been to every hand specialist in town, and nothing's helped, and I'll image them, and they have a herniated disc in their neck. See, the disc is pushing on a nerve that's going down. They don't have pain in their neck, but it's pushing on a nerve that's referring pain down here. Well, the camera can capture that. So their wrist didn't look bad on the thermogram, but their neck was a mess. Fix the neck, pain goes away. And the same thing can happen with the low back to feet. Someone can even think they have neuropathy, okay, and not have had chemo or mercury, alcohol, or sugar, or diabetic, or anything like that, and the problems in the low back. And with the camera, you can find that right away.
Which camera are you talking about? The thermometer?
The thermography camera, yeah.
Great. Any
Okay.
questions? All right.
It's a lot. If anybody has any questions, just feel free to email the center, and I will get back to you.
Great.
And thank you for watching.
Thank you, Dr. Bales.